So the most common reason for someone to have the need for a spinal fusion would be a degenerative condition called spondylolisthesis. This is when one of the vertebrae is starting to slide forward on the other, and that form of instability can not only be a pain generator, but it also narrows the space available for the nerves. So when we go in to do a decompression surgery, we could actually be causing more instability in their spine if we weren't doing a fusion at the same time. The most common symptoms we see with spondylolisthesis would be symptoms related to the nerves being pinched. So this can amount to either what we call radiculopathy, where a patient has a sort of burning sensation like a sciatica down a leg. The alternative to that is if all of the nerves are getting compressed at the same time. It's more of a vague symptom that people will describe where they have fatigue in their back and in both of their legs. They have trouble walking long distance. A lot of patients with this condition will need to lean onto a shopping cart just to get through the grocery store. And those are sort of the more subtle findings that we'll notice with advancing lumbar stenosis. So the non-surgical options for any form of a pinched nerve would involve starting some medications like an anti-inflammatory or a steroid. Sometimes we start medications like gabapentin, which can calm down an irritated nerve. Outside of medications, we can also consider physical therapy. Working with a therapist has really good data for working on pinched nerves, and they have good outcomes. Lastly, we start thinking about trying injections, and those can also have a great track record. If none of that's working, that's where we start thinking about surgical management. The most traditional non-minimally invasive fusion is just a fairly large incision right down the middle of your back, where we were able to put in rods and screws to lock everything into place to provide extra stability to your spine. Whereas the minimally invasive fusions come in a wide variety of techniques. One of the most common minimally invasive lumbar fusions that I perform is called a minimally invasive transforaminal lumbar interbody fusion. So in this surgery, it's usually multiple small incisions on the back of your spine, and that allows me to go in between muscle fibers so that we don't have to cut muscle, but instead we spread the muscle apart, and then we can still achieve the same goals of the more traditional open surgery. It's just less painful in the early post-operative period. We were able to address pinched nerves with this. We can address instability in the spine by still inserting the same hardware as if it was the more traditional surgery. The alternative to that, that's also a minimally invasive fusion, would be to go for a lateral fusion, and this is one where we go sort of through the side of the abdomen, and we sort of spread the muscle fibers apart, and we use special monitoring equipment to make sure that the nerves are not getting irritated during this, and we can actually perform a fusion with a very small incision and very minimal muscle dissection. In general, the recovery for a minimally invasive fusion tends to have similar restrictions to a standard fusion, but the pain is much less in the early period. There's less blood loss typically, and folks generally are discharged from the hospital faster and with less pain med requirements.